Welcome to this explainer. Have you ever wondered how a medical detective gathers life-saving clues without actually ever touching the scene? Well, today, we're diving into the incredibly fascinating art of observation in traditional Chinese medicine. It's this brilliant approach where the outside of the body acts as a perfect, real-time mirror for exactly what is happening deep on the inside.
Okay, let's just dive right in. In traditional Chinese medicine, or TCM, looking, which is called Wang Zhen, is quite literally one of the 4 foundational diagnostic methods. This ancient art form is entirely about deducing the internal state of a patient straight from their exterior. It's a totally non-invasive, yet highly informative way to assess everything from a person's vital qi and blood to their organ function, all the way to the presence of pathogenic influences. Think of the human body like a car's dashboard. Looking, or Wang Zhen, is exactly how the practitioner reads all those warning lights.
So our macro to micro journey today is going to cover 5 main areas. First, the art of looking. Second, spirit, shape, and posture. Third, reading the complexion and eyes. Fourth, we'll look at the tongue as a map. And finally, skin, secretions, and children.
All right, Section 1, the art of looking. Let's explore visual diagnoses in TCM. The role of observation in TCM diagnosis absolutely cannot be overstated. A practitioner isn't just, casually glancing at you. They're systematically scanning for really crucial data. The goals here are incredibly specific. They're actively assessing your overall vitality and that delicate, continuous balance of yin and yang. They're searching for subtle signs of heat, cold, excess, or deficiency. Now, this visual baseline is eventually combined with listening, asking, and palpating, but it is always the critical first step to identifying organ dysfunction, meridian imbalances, and even recognizing how your deeply held emotions might be physically manifesting. It completely sets the stage for an accurate diagnosis.
Moving right along to Section 2, spirit, shape, and posture. This is all about observing vitality. So imagine a patient just walked into the clinic. Literally, the very first thing a practitioner assesses is their shen, which translates to spirit or vitality. And shen isn't some mystical aura. It's a very tangible overall expression of life. It's seen in the clarity of your eyes, your facial expressions, your movements, and even how quickly you respond to a simple greeting. Shen is the ultimate indicator of your zheng qi, which is your body's vital resistance, and it directly reflects the underlying health of your heart and kidneys.
I mean, we've all seen this in real life, right? Think about how someone looks when they're truly thriving versus when they're battling a really nasty flu. A healthy shen is unmistakable: bright eyes, clear mind, upright posture, and swift responsiveness. But a disturbed shen? That tells a story of internal struggle, often showing up as dull eyes, confusion, restlessness, or deep depression. And in extreme medical situations, practitioners are acutely looking out for shen collapse, which is a highly dangerous state involving delirium, coma, a total inability to focus, and a very weak pulse.
Beyond just the spirit, your actual physical shape gives massive, immediate clues to a trained eye. Notice how just sitting with an upright posture indicates strong zheng qi. But if someone is slouched or overly stiff, it points the detective straight toward qi or blood stagnation, wind, or underlying pain. Even general body mass speaks volumes here. A very thin body can indicate a yin or blood deficiency, while an obese body might signal the presence of dampness, phlegm, or a deficiency in spleen qi. So your posture and shape are quite literally broadcasting your internal balance before you even say hello.
Okay, Section 3, reading complexion and eyes. Basically, mapping the face. It is just so brilliant how the face acts as this color-coded map that's directly tied to the 5 elements and specific internal organs. For instance, notice how a pale complexion ties directly to metal and earth, so the lungs and spleen, which indicates cold or deficiency in blood or qi. The color red strongly links to fire and the heart, pointing straight to heat. Yellow indicates earth and the spleen, revealing dampness. A blue-green tint, that points to wood and the liver, meaning pain or wind. And finally, a dark gray or black complexion relates to water and the kidneys, warning of cold or kidney deficiency.
And right in the center of that facial map are, of course, the eyes. We already know the eyes show shen, but they specifically reflect the exact state of the liver, as well as its blood or yin levels. Bright, clear eyes, you've got good liver blood. But if they're dull or lifeless, that definitely points toward a yin deficiency. Now, if the eyes are red and swollen, the practitioner immediately suspects liver fire or wind heat. What about chronically dry eyes? That is a classic sign of liver yin deficiency. And if there's jaundice in the sclera, that yellowing of the whites of the eyes, it's a clear sign of damp heat or damp cold lodged ripe in the liver or gallbladder.
Let's head into Section 4,
the tongue as a map. This is your real-time monitor.
The tongue is basically legendary in TCM diagnosis. As our source material points out, it is, quote, one of the most important diagnostic tools in TCM, reflecting the state of the zongfu, qi blood, and pathogenic factors. It turns out the tongue is a perfectly visible muscle that is constantly bathed in body fluids, making it one of the most accurate, accessible, real-time monitors in the entire human body.
Seriously, next time you're brushing your teeth, check this out. A practitioner thoroughly analyzes 3 distinct features: color, shape, and coating. Let's quickly break that down. A red body means heat, pale means cold, and purple means blood stasis. The physical shape is just as telling. A swollen tongue means dampness, a very thin one means deficiency, and a cracked one points directly to yin deficiency. Finally, they look at the coating, which primarily reflects the stomach and the presence of dampness or phlegm. A white coat means cold, a yellow coat means heat, and a remarkably thick coat means you are definitely dealing with an excess condition.
And this setup brilliantly illustrates just how interconnected the whole TCM diagnostic framework really is. Different zones of the tongue act as a literal geographic map of the internal organs. The tip corresponds to the heart and lung, the center relates to the spleen and stomach, the sides show the state of the liver and gallbladder, and the root, way in the back, reflects the kidneys. If a practitioner spots a bright red dot only on the tip of the tongue, the detective knows exactly where the heat is located.
Finally, Section 5, Skin, Secretions, and Children. We're looking at pathologies and pediatrics here.
Moving out to the very edges of the body, the skin and limbs provide huge external signs of internal fluid and wind pathologies. Got really dry skin? That indicates a blood or yin deficiency, or maybe the presence of a dryness pathogen. Edema, which is that noticeable swelling, points to fluid retention, meaning dampness or yang deficiency. If a practitioner observes tremors in the hands or limbs, they immediately think of internal wind or liver wind. And numbness often reveals a blood deficiency or wind and dampness actively blocking the energy channels.
Now, a true medical detective cannot be squeamish, right? Because they need to look incredibly closely at what the body is discarding. All secretions, including sputum, sweat, urine, and stools, they're rigorously categorized by color and consistency to diagnose heat, cold, or dampness. For example, spontaneous daytime sweat points to qi deficiency, whereas night sweats mean yin deficiency. Dark urine indicates heat, while very clear fluids suggest cold. It's all highly valuable data.
And because infants and toddlers literally cannot describe their symptoms, this art of looking goes from being just important to being absolutely critical. Practitioners rely on highly specific visual cues for pediatrics. They look at the superficial vein on the index finger to quickly assess wind, cold, or heat. They carefully observe the exact tone and timing of crying to differentiate between hunger, pain, or fear. And they examine the fontanelle, the soft spot on a baby's head. If it's sunken, it indicates a deep deficiency. If it's bulging, it means an excess condition.
So, what's the big takeaway here? The crucial point is that your body is constantly communicating with you. It's leaving these undeniable clues everywhere, from the color of your cheeks to the exact shape of your tongue. I want to leave you with this provocative thought. Next time you look in the mirror, try being your own medical detective. What are your posture, your complexion, and your tongue revealing about your internal health today? Thank you so much for joining me on this explainer, and keep observing.